Back with you at 9:12. As our state continues to work to close a nearly $900 million budget gap, it's not only hurting our bottom line as taxpayers, it's also affecting those who cannot help themselves. We're talking about terminally ill children. But what does our capital crisis really have to do with these children? Joining us now to talk about this and break this down for us, we have Ryan McLaughlin with OKC HopeLink. Thank you so much for being with us.
Thank you for having me, Abigail.
Really,
I appreciate it.
Really important to talk about this. What is OKC HopeLink for those who might not be familiar?
Yeah. Well, HopeLink is a nonprofit that reaches out to families who have children with rare, serious, or undiagnosed disorders. So we have families with all kinds of issues. I know we started it, my husband and I founded and created HopeLink with some friends of ours because our daughter was diagnosed with a rare genetic disorder that no one had ever heard of. And so we really reach out to families with really rare disorders that people can't really pronounce sometimes.
Sure.
We have people that have kids with cancer and kids that have Down syndrome and autism. So anything and everything in between. It's a support group, and we really try to support the family because that people group is really often forgotten by society.
Sure. Do you support them financially, or do you walk them through the process? Say, we've been through this, we recommend these doctors, or this is a great resource to get to the hospital, or we work with this charity. How do you support them in what way?
It's more of the latter.
Okay.
So we do have some scholarships to medical conferences, but mainly what our main focus is just really supporting the family and directing them to the right connections. We have a monthly support group for moms. So we meet the first Thursday of every month at Bridgeway Church at 6:30 p.m. And then we meet as families throughout the year and have different events and really promote the parents and try to support that as well. And so just really focusing on the family and keeping that intact. So.
What does this wonderful group have to do with the state's budget crisis?
Well, it's really a scary time for parents like myself. I actually have 3 kids that receive supplemental insurance through the state. So we receive something called TEFRA, which is Medicaid through the state.
Sure.
So my kids receive Medicaid just based on their disability and their diagnosis. And so because of 2 of them have had a terminal diagnosis, they receive this Medicaid. And that is what the majority of our group is made up of, are families just like that. So kids that are on Medicaid mainly just because of their diagnosis. So these are families that contribute to society, they work, they are involved in their community, and they need help. So I know just for our family, our daughter has a can of formula that's $100, and she uses 1 can of formula a week, and that's expensive.
Sure.
Even with regular insurance. So these are hundreds and thousands of dollars, even with insurance coming in. And so things like that supplemental Medicaid through the state saves our lives. It extends the lives of our children. It ensures the lives of our children because it ensures their hospital stays. It ensures home health, therapies, different things like that.
And you're afraid this could be on the chopping block?
It absolutely is on the chopping block.
And when you refer to TEFRA, this stands for Tax Equity and Fiscal Responsibility Act. And you say 3 out of your 5 kids?
Yes.
How old are your kids that receive TEFRA?
Yes. Well, our eldest daughter passed away in 2012, and she was 7 when she passed away, and she had been on TEFRA from the beginning when it first started in the state of Oklahoma.
I'm so sorry.
Thank you.
I did not
Thank
know
you.
that.
No, it's okay. So both of our daughters have the same diagnosis.
Okay.
Our youngest daughter with that diagnosis, which is NKH, she's 5, almost 6. And then our son, Henry, is almost 9.
Who's here with us.
So, who is here with us.
He's supporting Mom.
Yeah.
He's here. Hi,
he
Henry.
Is. He's being a good boy, good
he
support.
He's a little shy. It's good though.
Yes.
We need our studio to be quiet so we can hear. But I know that you guys are supporting the cigarette tax that is being proposed. What does the cigarette tax have to do with OKC HopeLink?
Well, in the past, the state of Oklahoma has used the cigarette tax to fund TEFRA. So it has used the cigarette tax to fund the Oklahoma Healthcare Authority, which in turn, that's how TEFRA is funded. And so what we're asking our state leaders to do is to lay aside the politics and to support its people, to really get behind the Oklahoma Standard and get behind what it says it preaches, and that is focusing on life and supporting life, being pro-life in the womb, being pro-life out of the womb, supporting life in the form of the cigarette tax, which would in turn fund Oklahoma Healthcare Authority and fund the lives of our children.
There is a cigarette tax being proposed right now, $1.50 per pack tax. There was also some talk about a 67% or 67-cent tax, I should say. Would you be supportive of that? About half-ish?
Well, it's half. So you just I think of it as my daughter's half a feeding pump, half of her supplies per month, half of her feeding tube. I mean, how do you supply half of what a child needs to live? And it's unconscionable to me that our state leaders are debating something like this. It's a $1.50 tax on cigarettes. I think we can push past our political differences and fully fund Oklahoma Healthcare Authority and DHS by passing something like this.
Is this something you've lobbied? Have you talked to your local lawmakers? Have you said, let me show you pictures of my daughter?
Yes.
Let me show you what my daughter needs?
Yes.
And what has been their reaction?
Yes. My friend Amy Anderson, who's also a fellow HopeLink mama, she and I have been up at the Capitol. Several of us have been up at the Capitol the last 5 weeks or so, and we have done just that very thing. And mixed messages, lots of, oh, we're so supportive, I'm so sorry, tears in their eyes when they hear the story, but then almost automatic, well, we've got to do this, the Democrats are doing this, or the Republicans are doing this, we've got to do, we should have accepted Medicaid when it was offered, and just back and forth a political game, which I certainly understand. But I also understand the cost of life.
Sure.
So.
I think the problem is there's no money.
Right.
And they're trying to find places to find money. I mean, we're in the hole nearly $1 billion. We're talking $900 million in the hole. And so they're trying to find these places for the money. And when it impacts your children or your family, I mean, it makes you emotional. And I see the emotion in your eyes, no doubt about that, and especially your little boy who's here. Do have a viewer question, because we reached out to our viewers on this.
Yeah.
Phil said, stop demanding others support your wants. If you want to fund health care, do so out of your own pocket and stop reaching into the pockets of those you have been taught to dislike, like those who choose to smoke or drink alcohol. If those two can be targeted, why not include sugary drinks, fast food, or make driving violations a minimum $10,000 fine? After all, it's about forcing people to obey. If those two can be targeted, why not include sugary drinks or fast food? Have you thought about maybe lobbying for something other than cigarettes? You know, it seems like one group is really being targeted here.
And I think that you hit the nail on the head before, is that the state of Oklahoma is just kind of scrambling for funds, right? And so historically, this is where the funds have come from,
cigarettes.
Phil, and it's from the cigarette tax. And I understand a lot of people take that side of things. It's kind of, Oklahomans are very much pull yourself up by the bootstraps kind of folks and work hard. And unfortunately, that's not how the real world is a lot of times. And we're not talking about drug addicts. We're not talking about people who've put themselves in this position. We're talking about children who are born with these conditions. And so I think it's something we can do. I also wanted to point out that Oklahoma spends less per capita, so less on each individual than almost anyone in the United States. There's only one other state that spends less on its citizens than we do in the state of Oklahoma. And so I think, as far as thinking along revenue lines and gross production tax and all of those things, Oklahoma really needs to be aware, our citizens need to be aware that our government hardly spends anything on us as citizens, so we can afford to go up in taxes a little bit.
Okay, really great information. I appreciate you being here, sharing your story. We're going to have you stick around for one more segment because we have a lot of viewer questions for you. Do you want to get a quick check of the forecast, and we'll continue this conversation in just a moment.